Welcome to Hormonify and Hormonify's podcast. As you can see, we are in our new studio, which happens to be my old GYN office. All these pictures I have collected over the years was through auctions and garage sales and things like that I enjoyed finding these treasures that I enjoy looking at. So I hope you enjoy the podcast and in our new studio. So we'll start with an example of how messed up medicine has become in the field, for example, of OBGYN/hormone therapy. I had a patient yesterday who was seen because she needed my advice, but unfortunately it was after the fact. What do I mean? So she went to her gynecologist who put her on some kind of hormone therapy and then said, well, what you need is the pellet therapy. The pellet therapy is when you insert into your buttocks a little pellet that supposedly slowly disseminates the hormone of testosterone into your body, which cures your hormone problems. Absolutely fallacious. It loads it up, it explodes into your body, creates male levels of testosterone and all sorts of problems, including the masculinization of the female, which means you transition to male over time, and abnormal bleeding because your balancing hormones is way off. So the doctor went ahead and put her on progesterone at night, changed the dose, did another thing with estrogen cream, did another thing with injections of other medications, basically to try to control the bleeding, which persisted for 6 months. Had an ultrasound, endometrial biopsy, and then, believe it or not, referred her to a surgeon to do a hysterectomy, all because she was placed on the pellet. I see this so often, it makes me crazy. And I said to her, why did you have the hysterectomy? The doctor said that I may have cancer. But I said, didn't you have a negative endometrial biopsy? Yes, I did. Was the ultrasound showing you had cancer? No, it did not. So this is the scam that is going on in the field of GYN in this case, and in the field of hormone replacement therapy, where the doctor created the problem to then have the doctor create a situation where she needed surgery, where everyone made money and the patient had a hysterectomy for no reason whatsoever. So I said to her, you should have come to me before. She says, well, my doctor insisted, and I liked my doctor. I've had my doctor for years. I trusted her. So now we get to the issue of trust. Who do you trust? Today, after the COVID vaccination scam and all the things we're learning about pharmaceutical companies, it's very difficult to trust anyone, including representatives of pharmaceutical companies. Who are they? Those are the doctors. The doctors are salespeople for pharmaceutical companies. So what is the philosophy behind what we do here at Hormonify, what I've developed over the last 30, 35 years? I use logic. Let's try to figure out the paradigm of what causes the problems. 26 symptoms are caused by problems in the females with abnormal hormones and abnormal balancing of the 4 groups of hormones required for proper hormone replacement. Pharmaceutical companies teach the doctors, treat the symptom. So if symptom is 26, let's put her on 10 medications. Let's put her on 12 medications. It doesn't cure the problems, but at least we make a lot of money. That is the reality of what's going on in this field. The worst therapy I have seen is the pellet therapy, because not only does it not balance the hormones properly, it causes problems. In this particular patient, who was 68 years old by the time I saw her, she's been on the pellet therapy for years. She had an unnecessary surgery. Now, she survived. On the other hand, all unnecessary. Think about the expense that the system had to pay for her surgery and all of her biopsies and all of her ultrasounds and all of the crazy stuff that was done to her. All she had to do was go to a doctor who knows what he or she is doing. So that is something that gives me a lot of motivation. That motivates me because what I said to her yesterday, and I have this every day, is that we'll check your levels, we'll balance your hormones, you won't have a problem right now. And she said, well, my uterus is out anyway. I said, yeah, it's unfortunate because it was unnecessary surgery. So, but I liked my doctor. So in other words, you can like your doctor. Doesn't matter how much you like them, they like you. You have to realize this is a very specialized area. Now, you may need neurosurgical procedure because you have a brain tumor. And you go to the doctor. Neurosurgeons tend to be less social, let's put it that way. You may not like him, but you know what? It doesn't matter. You're going for someone who has the skills to perform the surgery, crack open your head, take out a tumor, and you don't end up a vegetable. So who cares if you like your doctor anymore? The doctor is not there as your friend. The doctor is there with knowledge, supposedly, then gives you recommendations and works with you more like a counselor would work with you, but also someone who can direct you to the proper information. In my website that I created, tons of articles, we have tons of YouTube videos that explains exactly the way you need to approach the problem based on my years and years of research, plus clinical material. I have over 1 million patient months of experience. I've been watching YouTubes. My producer wants me to watch YouTubes of other people talking about hormones. I watched a few. First of all, they're a lot younger, and most of them are beautiful women. So what? What difference does it make how they look? But they convince you that the best thing to do is what they're saying. So what do? They use a standard therapy, 20, 30 years old. They know nothing. They have done no research. They have no knowledge. They just repeat what's been done 20 years ago and say, here, it's bioidentical. Well, true, it is bioidentical. But so is cyanide. So is arsenic. They're all bioidentical. They're all natural products. But that doesn't mean that they know enough to properly balance with 4 groups. Think about the variables of 4 groups of hormones that need to be put together. So you can give creams, injections, you can give patches, you can give pills, you can give, in our case, troches, but we've developed the simple formulation of the 4 hormone groups that are required, not 3, not 2, not 1. I'd say 98% of the people need 4, that are required to balance your hormones and relieve your symptoms. So what kind of symptoms are relieved? I had a patient 2 weeks ago. She is a model, supermodel in Miami. And she looked absolutely gorgeous. She was 50-something years old, and she was concerned about collagen in her face that she's losing, and that's part of the aging process. And so and she's on collagen supplements, collagen protein. She's spending a fortune. But she doesn't know, and nor does her doctor who tells her to go ahead and a plastic surgeon to take collagen, is that the collagen molecule is a very large protein, 3,000 amino acids, then 3 chains, 1,000 each more or less. And it's broken down into the stomach, into the liver, into short-chain polypeptides. Those do not remain intact as collagen. It's just a very expensive form of giving you the protein that builds it up. So what lays down the collagen? What makes a woman look youthful over time in my patient population? It's that they go ahead and take the hormones that we give them that actually are crucial in placing the collagen molecule into the face and producing it so that you restore the collagen that's lost with hormone deficiencies. In other words, you can take as much collagen as you want. There's no studies to show, none, 0, that your collagen is going to go into your face. Doesn't happen. It's a myth. It's a $4 billion industry that's built on scam. Okay, so you can spend your money that way, or you can consider evaluating your hormone status. So what is the glow of pregnancy? The glow of pregnancy is when a woman who's early pregnant, and especially in the early part of the 2nd trimester to the beginning of the 3rd trimester, she's under the influence of progesterone. Progesterone at very high levels immediately increases the collagen production in the face. And that's the glow of pregnancy. What happens to a pregnant woman whose hair becomes amazing? How many millions of dollars are spent on hair products in women who are 45 to 55? Their hair gets brittle, gets thin. It gets quite unattractive. Millions and millions of dollars because nobody is saying what caused the problem. In my experience, what caused the problem is the hormone deficiencies, mainly progesterone. Yes, estrogen has something to do with it. It's mainly progesterone. Again, in pregnancy, any woman here is listening to this, when she's pregnant, her face looks great, her hair looks great, she feels great. That is the wonderful nature of pregnancy, to make women want to get pregnant again, in spite of the labor issue. So when I looked at that as an obstetrician and delivering tens of thousands of babies, what I learned over the years was something I'm giving to you. Is this years of experience, which you cannot get in any textbook, is that women who go through depressive episodes, especially postpartum, is all related to hormone deficiencies. For 30 years when I did obstetrics, I treated that with progesterone therapy with a 100% cure rate. What do they do today? They hospitalize you, or they put you on antidepressants, anti-anxiety meds, a sleeping pill. Think about that for a second. So what is the concept? What is the dichotomy here? The dichotomy is that you need to think rationally and establish the paradigm for treatment for all of these problems. So the paradigm for treatment, if you treat by symptom, which is the pharmaceutical model, is what I've just described. No result, not great, you're sedated, you feel terrible, and analyze and figure out what in the postpartum period causes deficiency of progesterone. Well, it's obvious. The body knows more than we know, and that the body says, don't get pregnant right away. We'll not produce an egg. We won't produce progesterone. So along comes Dr. Eckert and says, wait 1 second, that's really cool. So if they develop these symptoms of lack of progesterone, replace them with progesterone. They're still not ovulating, they're not producing an egg, they're not going to get pregnant, but our symptoms are relieved 100% of the time. So what I try to do and explain to you, and I'm not pretty and I'm relatively old. In our culture, wisdom is not respected. Youthful appearance is. So I see these, I'm telling you, I saw one yesterday, beautiful woman, she's evidently a doctor, who is spouting bullshit. Just saying generalities, not knowing what she's talking about, sounds great, looks great. I mean, she's absolutely a beautiful woman, but has no sense, I can tell, because she doesn't research anything. All she says is what's out there about bioidentical hormones. And what does she give? She gives estrogen and progesterone in a pill form, which if she knew anything about hormones, knows that it's not going to last 24 hours. It's going to last 8, 9, 10 hours. I've checked it. I've checked thousands of people, and their levels are not adequate enough 12 hours later to be helpful in helping women in the symptomatology and in preventing the medical problems that are associated with deficiencies of hormones in women, which are extensive. Osteoporosis, depression, anxiety, weight gain, heart condition, breast cancer, uterine cancer. All of these are related to hormone therapy. So when I analyze a patient, when I see them, and I meet them for the first time, hopefully it's in person, but I'd say about 60% of our patients are not in person. We have ability to see you on the computer, and I analyze what are the problem lists and how do they define themselves. It's very simple. If you look at the etiology of the symptoms, you can clump them together, okay? And you can have different diagnoses based on what the history is, and I kind of know, just by talking to them for a few minutes, what it is that I need to do. However, if I just said after 10 minutes, well, I know what to do, here it is, goodbye, they're not going to think it's real. But after you do this tens of thousands of times, women especially fall into groups, and the grouping is almost always correct. I quantify it by laboratory testing. So, what is laboratory testing? You have to know what to test. And when I get these lab tests from these doctors who've been, quote, experts, complete, like 60 tests, but they don't know what to test. You don't need to get 60 tests. I get 6 different items. And I developed it because I don't need the 54. Because you need enough to know what you need to treat. You don't need to go ahead and get every single test available. But we do, which most people do not do, a metabolic profile in terms of antioxidants, minerals, and omegas. I would say 90% of the patients are taking supplements, but they're taking the wrong ones. They're not taking the ones that are required based on laboratory objective evidence, so therefore we replace them based on lab work. Nobody's doing that. You go to a health food store, you speak to some idiot person there who tells you, well, I think you should be on, you're having this symptom, you should be on CoQ10, you should be on omega, but they don't know. It's complete garbage. Plus, of course, the quality of the product. So why do I bring that up? Because you have to base your decision making, at least I do, on different levels of thought. First level, the cells need certain nutritional aspects, so we have to be an expert in nutrition. Then it's definitely the sex hormone, which affects every single cell in your body. After that, the adrenal gland function, especially after the COVID vaccination debacle. And after that, we have the weight issue, which is very common. So 50 to 60% of Americans are obese. Some morbid obese, some not. That is incredible. The morbidity and mortality associated with obesity in this country is not going down. It started in the 40s, and the answer was sugar. So when these doctors, especially endocrinologists, who treat, quote, obesity, what do? They go right to the GLP-1, tirzepatide, or the other drugs that are out there that right away treat, yes, you lose weight. But what about all the other things that need to be built up first? They don't do that. All they want to do is sell you something. They're selling you drugs. In this case, the GLP-1, which is an excellent drug. Okay, no question about it. And now, believe it or not, they want to apply for Medicare coverage of the drug, which is going to cost America $3 trillion. So what is it that we need to look at? This is a big mistake. RFK Jr. even had a press conference on this, and he's absolutely correct. Nutrition, exercise, hormone replacement, adrenal gland function. These are the things that need to be done first before you turn to the GLP-1s. All of those things, and that's what we do in our practice. Yes, we use GLP-1s, those that absolutely need it, but we check certain testing that we make sure is a candidate for the GLP-1. So we have people coming to our practice who've been on it for 2 years, spending $1,200, $1,400 a month of your money, of insurance money, for 2 years. That's about $30,000. And they lost 8 pounds. So in other words, why didn't it work? The doctor keeps on upping the dose, and then they develop abnormal pancreatic profiles or abnormal liver profiles. So now what happens is that you're producing another disease that will require maybe more medication or death, and that's how it works in the medical world today. So if you want to go ahead and listen to a pretty young woman who tells you to take this hormone because it's bioidentical, fine. You got to do what's best for you. But if we, as at Hormonify, really are dedicated to helping you, and that's what this video is about. How can we help you? How can we improve your health, reduce medical complications, make you look better? Now, I hate the concept of anti-aging. When I see anti-aging, I throw up, because that means you're dead. That's what it means. Aging is great. Look at me, okay? I'm not a young guy. I'm aging. But I'm aging in such a way that I feel healthy, a lot of energy, 100%, never felt better. Yet, the anti-aging group, they follow the same abnormal pattern. Is that you take 14 supplements, okay? And they don't know what they're doing. They just give you supplements. Then if they give you hormones, they'll give you a form of the hormone that is absolutely not indicated, or they give you the pellet. That is where most of these pellet patients come from, these anti-aging clinics. And if you look, they have 6 people in marketing, and they have 1 or 2 nurse practitioners, and maybe a doctor. But if you call the place, you can't get hold of the doctor, because that doctor's not there, okay? That's not the way medical practice should be not only initiated, but should be practiced to give you the most information, the most valid information, and not have 6 marketing people. I looked up a company, I'm not going to mention who it is. There were like 6 people, beautiful young people marketing, okay, to people. And they had 1 doctor who looked like 90 years old, and they had 2 nurse practitioners. So that was their, quote, medical group that went ahead, and they have offices all over the country. So it's a scam. All they're doing is marketing to you something. And what their hormone therapy program is? The pellet. Anyone can do the pellet. There are 4 to 5 million pellets sold in America every year. And if you have a 2% complication rate, which even if you ask them, they say it is, 2% complication of 4 million, okay? That's a lot of complications. I have seen 100 complications, and they're not pretty. Now, if you want to transition to a male, that's your choice. I mentioned that in another video. That's fine. I mean, that's your choice, and that's great. But if they don't tell you that that's what they're doing, that's not informed consent. Unfortunately, when you start with the pellet therapy, you signed away your right to sue. So if they didn't tell you that, you can't sue them. So to me, that's suspicious. Right away, when just happened with the COVID vaccinations, they got Congress, an act of Congress, to say that no matter what happens, you can't sue Pfizer. That was right away a red flag. So let's say you meet someone, great. Let's say you're a woman, you're meeting a guy, great guy. And then he has you sign a paper to say, no matter what I do to you, you can't sue me. If you're a woman out there, Let's say you're 50 years old, you have some assets, you're successful, intelligent. Yeah, you may be hormonally messed up, but would you sign that? Would you sign away your right to sue on any relationship at all unless there's something that they're hiding? And I'm there as a counter-revolutionary to tell you they're hiding the complications, which are severe, not fun. So what I'm trying to tell you is that what the hell are you doing sticking a pellet in your tush 4 times a year for 10 years? That's 40 cuts. I used to call it the Chinese torture, death by 1,000 cuts. I don't know if you're familiar with it, you can look it up. That's what I look at it as. It's crazy. Oral therapy, not swallowing, but putting something in your mouth, has been used for hundreds of years in obstetrics. I used to love reading about the history of obstetrics. And believe it or not, in the 1700s and 1800s, they used to be able to put Pitocin, which is oxytocin from pineal glands, from animals, into the cheek of royalty and women who had a lot of money and initiate labor. It's a historical fact that transbuccal absorption of hormones, which are large molecules, basically, is excellent. And I learned that. And I said, wait one second, this is a great concept for me to handle and master. And with our partner, which is Hazel Pharmacy, which is in Pennsylvania, we modified the ability to go ahead and not only give 1, 2, 3, to give 4 groups of hormones together in the same medication troche, which is the square that contains exactly the same amount every day, usually in divided doses. Now, we know how to manipulate based on the patient's symptomatology on how we take it. That takes experience. So when you see doctors or nurse practitioners getting lab work every 3 months, it's because they do not know what they're doing. Lab work should not be utilized as a modulation of therapy, which means that that's just only one moment in time. If you know what you're doing, a doctor should be able to ask you 5 to 10 questions. And in that 5 to 10 questions, know which hormone needs to be changed which way. 98% of the time, we do not do follow-up lab work. Sometimes after 5 years, the patient says, hey, I want to check my labs, I want to do my nutritional assessment, I want to check this, check that, so we'll do it. The point is that after doing this for 35 years, 5% need lab work when I'm not sure what's going on based on the history. Some of it is because the patients have senile dementia and they don't really have a good history to give me. Some of them just, it's confusing, I don't figure it out, and the lab work helped me. But to get lab work every 3 months, and sometimes you have to pay for it, they charge $250 some of these places, is a complete scam. That means that's by definition, they do not know what they're doing. Open up your eyes. Okay, so it's like you get something done on your car, which, by the way, a lot of people take better care of their car than they do themselves. I had a patient who was trying to do supplements. It was a crazy program. I said, well, what kind of a program is this? Well, I'm trying to do it myself. And of course, I asked her about who takes care for an oil change. Why don't you do your oil change? No, I need an expert to do my oil change in my car. So in other words, people do sometimes take care of their car better than themselves. So supplementation is only done based on objective evidence. It's not done just because you think it's that and think it's this. Most of the stuff that you buy online, in my experience when I analyzed, I had another patient. I looked at the protein she was on. She didn't know that it was nothing special, beautiful, beautiful container. It was whey protein, W-H-E-Y, which is from dairy. Now, you can buy a big jug of dairy protein for 1/3 the price if you want to get whey protein, which is not the best protein. As an example of how it was beautifully marketed. She was paying online $56 for a little container, and it was nothing but whey protein. And then I tried to look on the back and see what else was in there, because it says, and other ingredients. And it just lists the ingredients, but it doesn't tell you how much. So what I can do for you is to tell you is that if you have a product online and they don't tell you exactly how many milligrams it is, therefore it's probably 1 milligram or less. They can legally put it down as a listing, especially with these combo products that you get online. 98% of them are scams. Stay away. They're not physician quality. You don't know what they're really giving you in terms of milligrams. I don't believe most of the time supplements should be given as a group. It should be given individually based on laboratory assessment, which is what we do at Hormonify, which should be done wherever you are. So I think that basically gives you an outline as to why we have a problem. So in order for you to spend your money wisely and do what's best for you, stay away from the scams. If you have a question, you can drop a line to us. We have a big Facebook group. It's called Bioidentical Hormones on Facebook. Drop a line, drop a question, join up, or you can call our number and you can go ahead and leave a message, or you can go ahead and email us at info@hormonify.com, which is a very good way to get a response. Usually we respond within 24 hours. Usually we're with patients, so calling is not usually the best way. However, all of our practitioners are trained to go ahead and answer the questions that you can have. Good information. Go to the website, hormonify.com. We have 25, 30 articles I wrote that will help you explain more and get a fundamental knowledge of what it is that you want to accomplish, as opposed to just going to a doctor who's a, quote, hormone specialist who has beautiful blue eyes. So I think we're going to turn it over now to our producers who have frequently asked questions from our audience. So let's go ahead and deal with that.
You have beautiful blue eyes too, by the way.
I've been told. That's why I brought it up, so I feel secure about that.
A question for you, Dr. Eckert. My mother has just been recently diagnosed with osteoporosis.
Okay, that's a very common question. I'm glad you brought that up. So I have patients who's a patient of mine for years, and their bone scans may have come back osteopenic, which is a mild bone loss, and now it's normal. And women in their 70s and 80s, we have probably 1,000 who come in with osteoporosis, 100% cure. 100% cure. 0 fractures. Because the reason why they have it, again, back to the concept of etiology, is that they're lacking the hormones that maintain bone health. It's not estrogen, guys. That's a myth. Estrogen increases osteoblastic activity, which produces more bone, but it stimulates osteoclast, which destroys the bone faster. So therefore, estrogen is not the answer. So yes, definitely a candidate for therapy. We know how to dosage them so they not get overdosed. We understand that they're older and we don't want to give too much medication that's going to make their sex drive too large. But some of them really are happy about it. You know, this is a different generation too. A lot of them really want to remain sexually active in their 80s. And God bless them, and we help them with that.
I watch your podcasts religiously. I don't hear too much talk about men. Do you treat men?
Yes, of course. Men are less apt to watch things like this. They're too busy. They don't have time. They like politics. They like history. They like the Roman Empire. They don't usually go ahead and watch something like this. So I tend to talk more to the women. 80% of our patients are women, 20% men. Men are referred usually by their girlfriend, their wife, or their best friend at work. And so we have less need to address the issues of men. But absolutely, we're very conservative. We don't overdose. We have 0 complications. And we address all the issues surrounding not only erectile dysfunction as it relates to hormones, but also nutritional assessment as well, and also weight management. So weight management is usually done after the hormones are corrected, just like we do with females. And therefore, many times, all you need to do is correct the hormones, correct the adrenal gland function, correct testosterone mainly, make sure the estrogen level is not too high, and they begin to lose weight, lose fat, gain muscle.
Wonderful. Are there people that are not suitable candidates for BHRT?
Yes, dead people are not suitable. We don't treat anyone under 15. So we do have a division that specializes in young adult therapy. Believe it or not, from 16 to 24. I can't tell you how many hundreds of patients are mistreated by their gynecologists for conditions like amenorrhea, which is lack of periods, polycystic ovarian disease, Stine-Leventhal syndrome, ovarian cysts, with only birth control pills. And I think that is going to come back to haunt us as it does now. Elon Musk had a very famous text that he went ahead and basically reiterated the dangers of the massive amounts of birth control pills, not only in our water supply, which is feminizing our population, but also the increased risk of infertility, in young women in their 20s and 30s who have been on birth control pills.
Wonderful. I happen to personally know you as my physician and your personal mission. When you think about your legacy in the field of hormone optimization, what do you hope it will be?
Well, I think looking back on my life, and it's been great, I'm humble about my success, is to leave a legacy where the entire world, especially the entire United States, women especially, are going to be treated correctly for their hormone issues. That to me really bothered me when I started this, and I did a lot of research in terms of the corruption and the dishonesty in the field of hormone replacement therapy, mainly by pharmaceutical companies and the medical establishment, involving birth control pills, and primarily when the woman is younger, but also the way menopause is being treated or not treated. And they're placed on things like antidepressants and anti-anxiety and insomnia medicine. That really bothered me because I think it's a fundamental corruption in the role of a doctor to be honest with the patient. And if you don't know something, just say, I don't know. But instead, they're treated with things that are actually detrimental. So do no harm to me has taken over medicine. I can't tell you how many times a day. So in order to fight that, you have to start somewhere. And we started with Hormonify, and I think it's working to the point where, in a humble fashion, it's actually making a difference. And so I'm glad for that, and I continue to push forward in developing research projects to analyze the data correctly so we can further the regimen of treatment based on scientific fact versus based on research done by pharmaceutical companies that are based on complete bullshit.
Your passion stands out.
Yeah, for an old guy, I'm pretty passionate. You know, I try my best to look at the big picture. This is not an ego statement for me. Those who know me know that, you know, it's just I'm a regular guy who wants to do some good in the world. I know that sounds corny and old-fashioned. It's not like I believe doctors are all do-gooders, but when patients especially have a nephew or niece or a daughter or a son who wants to be in medicine, they ask me, you know, can I speak to them and what kind of advice I give them? And I say, why do they want to be a doctor? And they say, well, because she or he wants to help people. And I said, well, that's not good enough. I tell them then they should open up a hair salon. You can help people. It's cash business. You make a lot of money, and you'll help people. If you want, you have to have more than that to be successful in the medical community today. Because if you don't stand up for what's right and what's truthful, you will be decimated. You will work for a big corporation unless you follow their rules and follow their protocols. They will ruin your career. So it's unfortunate that's happened to that, but that's the way we are today. So there is going to be a counter-revolution that's occurring now where you have options and alternatives, as it was for thousands of years. And that's my goal, is to bring back standard logical therapy based on symptom analysis, but based on scientific data, laboratory confirmation. And to me, that is the way it needs to be treated all over the country and all over the world. Thank you for listening. Like, comment, and subscribe. We're more than happy to answer your comments, so try to notify us, as we said before. And we'll see you on the next podcast. Enjoy.